When they asked me to talk about the immune system and inflammation in endometriosis, I sort of started thinking, well, what exactly do we know about what's going on? And how can I convey that in a meaningful way for everyone today? So the sorts of things to think about are the general principles of the immune system and inflammation that are relevant to endometriosis, the kinds of changes that we see in the disease, and this is at the level of the uterus, the pelvic cavity, and also other body systems, what role exactly these play in the development and progression of the disease, and how they contribute to the associated pain and infertility. And then thinking about the link to other immune-related conditions, which includes autoimmune diseases and allergic and inflammatory conditions. I think we know a bit in this area, but there's still a lot of things that we're working on. And ultimately, why should we care? Why does this matter? And I think it matters that we know what's going on with the immune system, because we can potentially exploit this knowledge in terms of developing new treatments and also thinking about day-to-day how best to look after ourselves. So the immune system is the body's defence. It's made up of specialised cells and substances they produce, tissues and organs. The immune response is initiated when there's some sort of threat that occurs in the body. That can be an invading pathogen, some sort of germ, or a cell that's in the wrong place doing the wrong thing. Now, initially, this threat is picked up by a first-line response, which is quite non-specific. It's known as the innate immune system. And the threat attracts immune cells to travel through the circulation to the site and non-specifically attack it in an attempt to clean everything up and control it. And there are certain immune cells that are heavily involved in that, particularly macrophages, natural killer cells, and neutrophils. There's also another side to the immune response, which is more targeted. So immune cells will go to the site of the threat. These specific cells are called dendritic cells, where they'll capture information about what's going on, travel away from the site to the lymph nodes that are draining that particular area. And lymph nodes are immune tissues within the body that house a lot of different immune cells. Within the node, they will convey this information about the particular threat to resident cells, which then do lots of different things and will traffic from the lymph node back to the site where the threat is and initiate a specific response against it, which also involves the formation of a memory, so that subsequent times that the same sort of things happen, the response can be more rapid and more targeted. Now, this goes on in our body all the time and usually works quite well. But we do get into a bit of strife when things go wrong, and the sorts of things that can go wrong are allergies, where a response is mounted against something that actually isn't going to harm you, and also autoimmune diseases, when your body's own immune system is attacking other cells within the body. Now, inflammation is also a part of the immune response that's quite healthy within our bodies. It's a response to infection or injury, so some sort of danger or damage signal. It's a series of complex and coordinated processes such that the signal from the site of danger or damage is sent out, and blood vessels to the area dilate, and you get attraction of various immune cells, and they're primarily immune cells involved in the innate immune response. They release a series of mediators that send messages to elsewhere in the body. The cardinal signs of inflammation are redness, swelling, heat, and pain, with or without loss of function. And I mean, we all know this. If you sprain your ankle or cut your finger, this is the sort of thing that happens, which is quite normal. And in an acute short-term response, all being well, these processes occur and we get tissue repair and the issue is resolved. This is not always the case though, and if the cause of inflammation is not resolved, we can get ongoing chronic inflammation, which is associated with tissue damage. So in endometriosis, what are we seeing? Well, we see immune changes and inflammation within the uterus, and particularly in the endometrium. And these are localized changes in the number or function of immune cells, such that it appears overall there's an increase in the numbers of immune cells within the endometrium, but there's also altered ratios of the different cell types, and the patterns through the menstrual cycle are different in women with endometriosis compared to women without the disease. There are also locally altered levels of mediators of the immune response. And what all of this comes down to is that there's an inflammatory environment within the uterus with an impaired immune response. If we then consider the pelvic cavity in endometriosis, we've got endometriotic lesions there. Immune cells are recruited to these lesions, and these cells are activated, but they're actually not effective against the lesions, and the lesions persist. We also see changes within the peritoneal fluid. Again, you get this influx of immune cells, and the cells are activated along with higher levels of inflammatory mediators. And the bottom line here is that there is an immune response that's being mounted against the lesions in an attempt to clear them, but the inflammation and the mediators released by the immune cells in the pelvic cavity actually can promote the lesion growth and persistence. Even outside of the pelvis, we see some evidence of changes in terms of the immune system in endometriosis. So if we look at immune organs, and going back to lymph nodes, those lymph nodes that drain the areas affected by endometriosis, so there we're talking about the uterus, the endometriotic lesions themselves, and more broadly the pelvic cavity, the immune response within those nodes seems to be impaired. Within circulating blood, there's also some indications of changes with subtly altered ratios of different immune cell types and some inflammation. So again, the bottom line here is that systemically there's evidence of general inflammation and impaired immune response in endometriosis. Then how do we sort of fit all of this in within the most popular theory of endometriosis pathogenesis? So that would be starting from the endometrium within the uterus, where we see these immune changes that involve inflammation and an impaired immune response. Then at menstruation, when some of this tissue is shed, it has the opportunity to flow back up the fallopian tubes, which is actually quite normal, occurs in almost all women, but is a problem in the context of endometriosis because of the differences that we see. We have inflammation then within the pelvic cavity, and also an impaired immune response at that level, which allows for these tissues and cells within the pelvic cavity to adhere and implant, causing an influx of immune cells which are activated. But they're not effective, and we do get growth of endometriotic lesions with establishment of chronic inflammation. The lesions persist, the inflammation keeps on going, and then we get into a situation where this is contributing to the generation of symptoms in endometriosis. And exactly how that happens at the moment, we think that in terms of pain, immune cells are known to be able to produce substances which attract the growth of nerve fibres and promote their persistence. We also know that inflammation sensitises nerves and makes them more likely to generate pain signals. So then in the context of endometriosis, we have an immune and inflammatory contribution to the pain, which the implications of that are that anti-inflammatory painkillers are generally the first line of pain relief because they will counter the inflammation, by no means the only option, as we've heard in much more detail, but a good place to start. Immune issues in endometriosis can also negatively affect fertility. Given that with pregnancy, half of the genetic material comes from the father, the embryo and fetus are foreign in terms of the maternal immune system, and they need to be tolerated in a tightly controlled immune response. These same cells that are crucial for getting and staying pregnant under normal situations are known to be disturbed in endometriosis, although we don't fully understand the details of this. We also know generally that inflammation is linked to infertility. So again, unfortunately, we've got a situation where the things that are going on in endometriosis are detrimental for fertility, particularly considering the immune and inflammation aspects. Now, another side of this is a known link between endometriosis and other immune-related conditions. And if you're a woman with endometriosis, you have over a 20% higher chance than the general female population of having some sort of immune disease, autoimmune disease. And that's things like lupus, rheumatoid arthritis, or MS. The characteristics of endometriosis, which are similar to autoimmune conditions, include immune cell activation and abnormal function of these cells, a multi-site presentation, so it's affecting different areas, multiple areas within the body. We do see tissue damage, and also the increased occurrence within families and the genetic basis. But this isn't the only part of the story with immune-related conditions. There's also a link to inflammatory and allergic conditions with endometriosis. And the shocking statistic that I came across in researching for today was that if you have endometriosis, you have almost a 200 times greater risk of having chronic fatigue syndrome than the rest of the female population. And other inflammatory related conditions are also at increased risk for, such as pelvic inflammatory disease, irritable bowel syndrome, which we've heard a little bit about, and fibromyalgia, and also interstitial cystitis. And beyond this, there's an increased risk of allergic conditions, so like chronic nasal and sinus conditions, 20 times higher risk than the general population. All is not lost, and I hope I can finish on a more positive note. One of the things that is going on is that there's a lot more that we need to know. And the great work that Peter's done in terms of bringing the research community together and prioritising things. So these things that I put up that we're still working on actually have come out of these research priorities documents. So we're working to get a broader perspective of the immune dysfunction and inflammation that's occurring in endometriosis, because historically people have sort of zeroed in on one specific cell type or one kind of mediator. But we need to understand more on a whole what's going on. There's also work underway in terms of looking at environmental and immune interactions, because certain environmental exposures are tied to endometriosis and they have immune effects. We don't know exactly how this works. The mechanisms behind the link between endometriosis and other immune-related conditions, and then the exact relationship between these immune changes and disease establishment and severity. Are they a cause? Are they an effect of the disease? We just don't know quite yet. One of the aspects that we're really interested in working on in my group is the details of exactly how immune function in endometriosis impacts the associated pain and infertility. And then ultimately how we can use this information to better manage the disease, which leads me to why we should care. Why does this matter? And one of the areas that's being looked at is possible immune-targeted treatments for endometriosis. They're a ways off. I mean, some immune-related drugs are sort of used ad hoc in endometriosis management, but also looking at newer, more targeted drugs for inflammation and immune modulation that are being trialled in animal models. And there's some promising initial results, but it's a ways off, obviously, if we're at the animal model stage. The other reason why we should pay attention to this, and this is something that we've heard already through the day, and I'm sure we'll hear more about this afternoon, we need to think about what we know about endometriosis and then how we use that knowledge in terms of day-to-day things that we do for ourselves. So is there anything simple that we can do to help support immune function and just generally reduce inflammation? Unfortunately, there's no magic wand here, there's no quick fix. It is another area of research that is still early days, and it's limited in some aspects, but as with a lot of other things, it pays to generally look after yourself, and particularly in relation to the immune system, although this is easier said than done, managing stress and depression is important because they're both known to negatively affect immune function. That's quite well established in the literature. Also, there may be some anti-inflammatory measures that you can sort of work on for yourself, and one of the things at the moment that's quite popular is anti-inflammatory dietary approaches. So just to recap, the important things to understand in terms of the immune system in endometriosis are that immune dysfunction does play a role in the disease, and that there's evidence of impaired immune response and inflammation within the uterus, the pelvic cavity, and other body systems, which contribute to the pain and infertility in the disease, and also link to other immune-related conditions that coexist with endometriosis. It's an area of ongoing research, and the goal of all of that research is that better understanding will help us improve management. So these are some of the key references that are used in putting this together. I'd like to thank the people who cast their eyes over this and gave me some great feedback along the way. If anyone has any, wants to follow up any of these references or get in touch with me, email's the best way. Thank you.